Hi, everybody. Welcome to another episode of Orthopod. My name is Mo Bandari. I'm editor-in-chief of Ortho Evidence, and I have back for a second visit to us on Orthopod two colleagues and friends who have been really amidst the front lines and what's happening in Spain, both coming from Barcelona. Let me introduce Drs. Joan Minguell and Drs. Ernesto Guerra, both at Vall, both in leadership roles and have been very involved in the COVID situation in Spain. I might ask both of you gentlemen, first of all, hello, and thank you for joining. And secondly,
Hello,
I might ask,
Mo.
thank you. I might ask Ernesto if you wouldn't mind starting off and sharing some of your thoughts on, as you've talked about the second wave of COVID in Spain.
Yeah. Good evening and thanks again, Mo, for the invitation. First, I would like to express my regrets and show my solidarity with people from Lebanon for the yesterday's tragedy. We all know that it's a hard situation for them, and let's hope the situation will get better in the next future, the near future. My talk is the aim of the talk is to express if there is, to define if there is a really second wave in Spain, or it's only an outbreak. Let's start with the talk. Sorry. Okay. Here are the total number of cases that have been infected in Spain during the whole pandemic, and the total number of deaths, of casualties. It is near 30,000 cases. On the right side of the screen, you can see some estimations or projections that, depending of the source of the numbers, it differs a lot. But what is different with the previous outbreaks is that near the 100% of the cases are mild conditions, probably because the most of the patients actually are young patients without comorbidities. Unfortunately, there is not a scientific definition of what is a second wave. Remarkable epidemiologists have different opinions. One opinion is that after the first wave, it is necessary to have to reach low single digits to start with before starting with a second wave. And another outstanding epidemiologist said that after the first wave finish, it is necessary to have a sustained deep rise of infections. So the definition is totally arbitrary. Including the opinion of local leaders from Spain, from our government, they have also different opinions. One outstanding minister of Spain says that maybe we are in a second wave. We may be in a second wave, and the doctor that is controlling this, trying to control the pandemic in our country, he thinks differently, and he says, I don't think we are in a second wave right now, and we have to assess it day by day. So what is happening actually in Spain? There are, after the first outbreak, there was a stable plateau of 2 months during May and June. But unfortunately, after at the beginning of July, new cases started to appear in the hospitals. During the last 4 weeks, there has been more than 30,000 patients that has been infected, unfortunately. This is on the left side of the screen. We can see that during the stable plateau of May and June, there were around 100 and 200 patients per day, new cases, infected cases. And on the right side of the screen, we can see that recently, 2 days ago, there are near 3,000 patients that has been diagnosed with COVID-19. And
So Ernesto, can I just jump in for a second and ask you a question?
yeah,
When you look at that graph, that second graph of daily new cases, what do you think is happening? Do you believe we're in a second wave? I know you're being very data driven and it's confusing, but you know both of you have lots of insight here. What do you think is happening? It looks to me like there is definitely a period where they were controlled or it was really down for a period of months, and then it's looking like it definitely is a rise. It doesn't appear
yeah.
to be linked to the first to me, but I'm asking what your thoughts are because you're living it.
If we can see the two rows, we can establish that we are probably in the same situation that in the middle of March. So the numbers of cases are increasing. What is different is that patients are different. There are young people without comorbidities, and the cases are mild. That is why probably the admitted patients to the hospital are lower.
Can I ask again, and I apologize for
Yeah.
jumping in, but I know the people who might be listening or watching would be thinking the same thing is, do you believe there was something specifically that happened that led to the second rise? It looks like across the world, like we're looking at a very similar map in Australia and talking to Rebecca Ivers. It literally looks identical, different numbers, but looks identical. And we're seeing the same sorts of things happening in other parts of the world. And they say the same thing. The second rise, whatever that may be, whether it's part of the first wave and it's a peak or it's a second wave, seems to be younger individuals. And then they seem to attribute it, you know, to the following, that the younger individuals are the ones heading out. They're the ones now getting out into the beaches and going out and mingling, and they're catching it. Whereas the elderly are cocooned. They are aware and they're concerned and they're saying, we're staying in. Is that your perception of Spain as well?
Absolutely. It is how you say, Mo, after the restriction has been lifted, especially young people started to live, especially to have nightlife, and to get together more than 10 people as it was permitted or was restricted to 10 people. There were gathered around 100 and 300 people in the same places. It is curious that the restaurants and the discotheques and the nightclubs were open before the schools or the libraries. And probably these are the situations that are making these numbers to steady increase.
Okay, well, thank you.
Okay. So probably we are in the same situation that at the middle of March. And these are the number of death. We can see on the left side of the screen that the peak of the death were at the beginning of April. There were near 1,000 cases. After the stable plateau of May and June, now there are appearing some new casualties in the country. Regarding death also, we can see that after the plateau, in the last 4 months, 4 weeks, there has been over 100 deaths in the whole country. And regarding the admissions that has been in the hospital, it is in the last week between 30 and 40 people were hospitalized each day, and it is far different it was during the peak of the pandemic in April that near 2,000 people were admitted to the hospitals. This is the situation. This is probably the reasons that are producing these new outbreaks. Probably it was not a good message to say that a second wave was going to be on fall. Probably it was a wrong message because especially young people started to live and to enjoy life, especially in summertime. The restrictions were not respected. That's why the new cases are, most of them are young people, and the number of reproductions are more than 1.5. And let's remember that it needs to be below 1 if we want the situation to be controlled. I have resumed some factors that I consider have increased the risk of this new outbreak. And obviously it is the end of the state of alarm and isolation. People do not respect the new normality, do not accept the new normality. Probably we have to realize that we are in another situation until the new vaccine will be developed and tested. People is much more confident and believe that they are not going to be infected. Obviously, summer circumstances or habits predisposed to the infections. There are some seasonal workers that are to pick fruits or vegetables that do not have any health control. The social distancing have probably disappeared in many regions. Tourism from outside of the country, from different countries, from Europe and from other parts of the world are controlled or prohibited, but tourism from inside of the country, it has increased a lot. And outbreaks are associated actually with nightlife a lot. And so if how we can prevent the second wave? The second wave should be prevented with the new normality. The new normality. There is a study from Oxford, I think, that has revealed that if we wear constantly all the people a mask, probably the second wave will not appear in 18 months. Thus, regarding prevention, it is necessary to keep social distancing and hand washing. And to lower the impact of the second wave, it is necessary to reinforce the health systems, to increase the capacity of testing everybody or suspected people or unsuspected ones, to have the capacity to identify and isolate all infected cases, and to have the capacity also to tracing all contacts of infected cases. And that's all I wanted to say, Mo.
Well, thank you. Thank you very much. So let me ask you again, Ernesto, based on everything you know, and maybe while you are switching and transitioning from screen share to Joan, maybe you could stop sharing and then Joan, you could put your slides up. But could you once again help me understand, what do you think now is the current strategy? So what's happened right now currently? So now that your cases are rising on a daily rate, and I saw numbers getting higher and higher in this quote second period of increase, what's been happening is all of these, you're not in a lockdown again, but what is happening? What's the current policy?
Actually, there are some restrictions, obviously not as before, nor as in the phase 0, 1, or 2 or 3. that was before the de-escalation, but there has been some restriction yet. It is recommended that not more than 10 people have a gathering or meetings, no more than 10 people. It is an obligation to wear a mask, everybody, but it's probably is not respected for everybody, for everyone, but it's an obligation actually in Spain. And there are some other recommendations that are trying to prevent this situation. I think that probably in the next weeks, as we can see, the numbers are increasing, the restrictions will be stronger. I think it will change during the next weeks.
All right, thank you, Ernesto. I wonder if you could stop sharing your screen, Ernesto, and then that'll allow Joan to be able to, thank you.
Okay.
So I guess we're going to hear from you, Joan, more about the sort of the whole chronology of COVID in Spain. I think that was your plan, was it?
Yes.
Superb.
I want to thank you, Mo. It's a pleasure to be here with Ernesto, both friends, and also I express my solidarity to Lebanon people. How I say before, I will explain the three periods. No, in the first period, the gross pandemic, the resuming of elective surgery, and the second wave. No? Well, you know our hospital. No? We work in this very huge hospital, maybe the most huge of Spain. We are here in the trauma hospital. And maybe I will explain the situation of this hospital, because in this moment, the situation of every hospital, it could be different. No? This is the message also that Ernesto explains. As I said before, I talk with this pandemic situation, this very calm situation where we are resuming elective surgery, and this second wave. In the first pandemic experience, I explain the key points. First point is organization. We are with separated teams, with minimizing risk, with daily online meetings to support each other. Look of this is only the view of March. In 1 month, we reached the top. It's incredible, in 1 month. And we stopped surgery here in the middle of March. And you can see here, we reached 700 people. All COVID people. Now, these people are non-COVID in general. We will see later. Oh, sorry. And also, it's very important in this pandemic period, the protect staff members with specific COVID area, adequate personal protective equipment. 10% of our staff members were COVID positive. But these people are contaminated in the first stage, but there are nobody that has a nosocomial infection. And also we need to protect education. We start doing morning sessions online just in March. We stopped the elective surgery, as I said before, the 16th of March. We treat specific patients, not too much traumatic patients, but we have some sporadic cases. Also, we need to treat a spinal cord injury. We are a reference center in spinal cord injury in Catalonia. And the best challenge for us is the proximal femoral fracture, because they persist. We treat 2-3 cases a day in 60 per month. And in these cases, the mortality is totally superior. We analyzed the 31st day mortality, and it's extremely high, around 35%. We published this paper. In this pandemic first period, we need to be very collaborative with different teams. We transform in the hospital. The hospital in general has 40 ICU beds, and at the end, we have built 200 ICU beds. Is the main hospital treating critical patients in Spain. Also, a field hospital was set in the Frontline Hospital, and this was praised by the World Health Organization. And in the end of this period, we treat too much patients, a lot of patients. Hebron is the hospital that treats near 3,000 patients. This is the first period. And at last, but not least, we also did research, no, with COVID patients, and we published different papers, one with you, Mohit Bandari, of this. Second period is a totally different period that we don't believe that could be happen. This period starts in May. This period is the resuming of elective surgery. We start with a reunion with the director of the hospital. They say now is the time for surgeons. The first period is time for medical doctors. Now it's time for surgeons. This includes May and June, a part of July. You can see the 2 months, the reach in the end of May. We descend and we decide to start elective surgery based on data. And we start elective surgery when the number of ICU beds are around 80. This is a critical number that we calculate from the available anesthetist. But in our hospital, to understand how many is the elective surgery that we need to recover, we need to know what kind of surgery and the number of surgeries that we did in 1 year. In the whole hospital, in 2019, we did more than 36,000 interventions, 17 of orthopedic surgery. If you analyze the first 6 months of 2020 and 19, we lost a total of 6,000 surgeries. It's in the total surgeries, total specialties, and 920 in orthopedic. But you can see this curve, and in June, we have recovered the same surgeries than 2019. We don't believe it. We think that we never recover this until 6 months later, or maybe in January of 2021. But it's incredibly, this resuming of elective surgery is incredible.
So Joan, but before we jump in, let me ask this. Did you caught up so quickly? So were you given extra time? Was there more operating time? How did you catch up 6,000 surgeries overall? Like, that's a lot of surgeries, or whatever the number is.
We have recovered the same operating, sorry.
Okay. So you're back to the volume of surgery per month. Okay, got it. Yeah. Okay.
We have recovered the same. In June, the same. We did the same interventions, the same surgeries that the last year before.
Okay.
This is the loss of surgeries in orthopedic surgeries, and for the guidelines for resuming surgeries, be progressive and cautious. Well-selected patients. We need to have a strategy. Testing all the patients. We test more than 3,000 patients every month. I will show before later, and adapted personal equipment. No? We need to do a case prioritization. We need to analyze the age, comorbidities, socio-professional situation, kind of surgery, and you can do with 4 phases. These are our operating rooms. Normally we have 10 morning operating rooms. This is a normal situation, and 2 afternoon operating rooms. In the pandemic, this decreased to 1, only emergency surgeries, hip surgery, only hip surgery, 2, 3, 4 hip fractures a day. Then we increased slowly, progressively, number of operating rooms available, depending on the anesthetist available. Then in May, we recovered all the activity, and this is progressively because at the start, we have starting with patient surgery, ACL reconstruction, etc. And in June, in the middle of June, we started arthroplasties. And we have a plan to have more afternoon surgeries, more than usual 2, to recover the waiting list. If you analyze all the tests that we have in all the patients of elective surgery, we test every patient. Every patient needs to have a PCR test less than 72 hours before surgery. And if you, this data, you show only 0.5%, is the same number that May, June, and July, have positive PCR in this elective patient surgery. And now we are starting on a second wave. Yes, maybe this is the graph that Ernesto shows, similar than other countries. You can see Europe. Europe is different in different places, and in Catalonia is different in different villages, and in Barcelona are different in different hospitals. Now is totally different in every case. You need to analyze every region now on every hospital. This is the situation in July. It's totally different than the situation of March. You have seen that in March we arrived at 600 COVID patients in the same day and 165 critical people. Now, this is the situation in the last of July, 28th of July. We have 31 patients admitted in the normal ward and 13 in the critical patient. This patient I will explain later that are different patients. You can see the 2 months. In our hospital, always we have been patients with COVID. This is the lowest point, 7 in the ward and 5 in the critical. And this is the second wave. We start here. The number of critical patients we doubled it, but the situation is totally different. COVID patients now we are less than 40. In our hospital, a remark is in our hospital. Maybe in Lleida, the situation is another totally different. In Lleida, is 100 kilometers from Barcelona. They cancel all the elective surgery. But in general, in Barcelona, all the hospitals are doing elective surgery in May, June, and July. If you can see the patients that come in the hospital, this is data from July, from 22 of July to 28th of July. In one day, in the whole hospital, more than 400 people come to the hospital. From them, 25% admitted in the hospital. This is non-COVID patients. COVID patients come to the hospital 16, is a normal day, and only 3 admitted in the hospital. In general, now in this situation, less than 5% of the patients are admitted in the hospital for COVID patients. No? And if you analyze the situation of March and July, you can see in March, in the middle of the pandemic, at the end of March, in the people that admitted in the hospital, around 80. And in the critical area, around 10, 12. Of this, in the same day, people that go out of the hospital, in green to home, and in red, exitus people. Every day in my hospital, we have 10 exitus every day in the peak of the pandemic. Now, people admitted in the hospital is around 4, 5, 8, depending. 1 critical, but this critical is less critical as younger people and with a less severe disease. And we don't have exitus. In July, only we have 1 exitus in the whole July. And in the March, we have 10 exitus per day. And what's the difference now? Maybe the difference, the key point is we have more tests for patients and for workers. We have more tests, and we have bought this robot that we can analyze now 2,400 tests every day. At this, we starting with 100, then 400, and now we have this robot, and we can test people from our hospital and of the area. No? All the elective patients are tested. The second key point is that now we have enough protective equipment. We don't use now because we don't operate COVID patients. In the trauma hospital, we don't have any patient with COVID. These patients are in the general hospital. Now we are a little bit relaxing, but now no, because when the second wave is starting, we change a little bit because in the 1st of July, we are a little bit relaxing. All of us think that the second wave will start in October, and this become later. But now, 15 days later than the start of the second wave, we are not relaxing now. It's mandatory to wear mask in Spain, mandatory. And every contact, every worker that works in the hospital, if you have one contact, you need to have a test. you need to have quarantine from 10 days and then retest after work. Before this, you have only one test, and if you don't have symptoms, you can work with a mask. Now you can work. You need test 10 days. If you are asymptomatic, you need to stay at home 10 days and a new PCR and start working. That's the controller superior. We have more experience in surgical care. We have testing every patient, as I said before. All the patients are admitted in the same day. We're monitoring symptoms. Patients are operated with spinal anesthesia, avoiding postoperative nausea and vomiting to avoid contamination. We are doing extreme trauma prophylaxis. Every patient that's discharged from the admitted hospitals need a PCR test if this patient comes to the nursing home. This is new. And also another point very important is to manage data, and to not only data, also quality of care, no? Mortality, complications. We start a study, a multicenter study. We have, it's not published yet, with different hospitals that analyzed elective surgery complications. And in general, I don't have data because this is in review. But in general, we don't have complications. In our experience, we don't have complications in these patients operated in this second period. And the 90% of patients will repeat surgery, because in these patients, the problem is they are alone in the ward. They don't have visits, and sometimes a little bit of stressful, no? But these people repeat the surgery. More than 90% of people repeat the surgery. Another important key point for mitigation the second wave is local and national recommendations. Now we are more strict than 15 days before. It's totally free. We are restricted visitors another time. We are doing telematic visits, and we have organized canceled radiologics tests very strictly. This is my schedule from today. You can see today is 6th of August. I have visited 39 patients this morning. But we have presential visit, face-to-face visit, and telematic visit. You need to do this because you need to minimize risk of contamination of patient. This is the waiting room. You need to respect distance and be very strict of this. But 15 days before, maybe the image is not the same. This is the same now. We need to clean after patient by patient. Also, we need professional support. During all that, from March to now, I think we have a good support, but now we have also focus in post-traumatic stress, work hours. We need to have holidays. People are in holidays now. People need to be holidays. And also we have recommendations to workers, no, to telematic visits, etc. No? And for the last message, in the first period, the gross pandemic, you need to be well organized, informed, protected, and be collaborative. In the second period is the resume elective surgery, is to be based on data. You need to be progressive and cautious with a roadmap and prioritizing patients, and also monitoring complications. In the second wave, you need to test every patient and context, not to be relaxed, and also data collecting and follow the recommendations very strictly. And for all the periods, to combine this with research. And thank you very much.
Superb. Thank you so much for that, both of you, for very clear messaging. I'm struck with a couple of key questions, and I wonder if I could just get your take first, Joan, on this. These 6 strategies that you're using, how long do you think you're going to have to use these strategies? Is this now a few months? Remember, we last spoke, I think we had thought maybe, to the end of 2020. I think most groups now are thinking well into 2021. You may have heard large associations are not having group meetings. The American Academy has postponed its annual meeting from March 2021 now until August, end of August. What do you think is going to be sort of the current state of affairs in Spain? How long is this going to last, these approaches that we're using?
Looking that the second wave appear, I think that we need to not be relaxing, maybe during 1 year. We are relaxing in June. We think that it never happens. and now me personally, I change another time the behavior. I'm more strict. I return not a fear, no, but we need to be very conscious. We need to avoid meetings with 10 persons or more. We need to start doing telematic conferences. No, we are in the Catalan Society. Every month we have a meeting, and we try to do only online. No, and to avoid to go with people with more than 10 people, and be strict of this, and wearing mask. Be very strict.
Yeah. So you think this is going to go on?
You need to change all the behavior.
You think this will go past 2021? You think next summer we'll still be doing the same thing?
It's possible. It's possible.
Ernesto,
Because,
what do you think? Yeah, Ernesto, I'm curious what you. Okay, so you think it's possible, huh, Joan?
Yeah, obviously, it is necessary to analyze the situation and assess it day by day, week by week, month by month. Probably the life like it was before won't be the same until the tested vaccine will be developed, and its efficacy is demonstrated. Probably it will be more than 1 year, I think.
Yeah. So, and can you speak a little bit to also what's happened with respect to travel? So, for example, on top of the healthcare capacity, which it sounds like there is healthcare capacity in the second wave because the type of individuals aren't getting as sick, good or bad, but the risk is the more they get sick, they can bring back home, and then the elderly and the more vulnerable do get sick, and then they come back, right? So there's this vicious cycle potentially that could happen. What has been the impact on borders? So right now, are Spain's borders currently open, or can international travel been halted at this point?
Now there's an advice that people to avoid tourism from Germany, England to Catalonia and to Balearic Islands. But maybe this will change in 15 days, because the idea is to have data of your situation and show the data, be transparent. And then if you are transparent, you have good data, maybe in 15 days, they will change one in month, because always it's doing very quickly. At the end, you need to show that you are doing things. No, you have a second wave. Okay, now the authorities are very more strict. No, in Spain, it's mandatory to wear a mask now. And my kids are wearing the mask now every day. No, at the end is action, reaction. Show data, and if you show the good data, maybe in 15 days you can open. No. Maybe it was an advice of this, and this second wave, it is good for thinking, no, for patients, for people, and not relaxing, no, because it's easy to relax, no.
What are young people thinking? I mean, go ahead, Ernesto. I'm just curious. Yeah, go ahead.
Sorry, actually, the considerable number of European countries advise their citizens not to travel to Spain. If they travel to Spain, they are forced to have a quarantine when they get back to the country. And obviously that situation has stopped the international tourism to the country. Yeah.
No, that would make sense. Have the young people gotten the message? Are they aware now that the majority of the spread is happening through young people? Are they continuing to feel it's not them, and they can continue with their behavior, I guess you could say, or their relative non-concern? And I'm not saying young people are non-concerned, but if it's primarily happening in the young, is that message getting out to them?
That's the most important point, Mo.
Yeah.
I think the young people has relaxed a lot after the isolation. After the state of alarm has ended, they have lost their fear about the infection. This is a situation that should be emphasized, the new normality of of the country, the new normality of the continent, and the new normality of the world. It is necessary to emphasize, to spread the idea, the new, especially for young people, that is getting relaxed.
Yes.
And from your perspective now, what do both of you, how are your daily lives now currently changed? I know you've talked a little bit about, how you function and what you're doing, but mentally and, just from the point of view of sustaining what we're doing going forward, are you now making permanent changes to the way both of you are living? There are things we learn in this time where you think, I guess I don't really have to go back to doing that. Even when I can, I don't have to do that because it's not as efficient. Are there things you've just permanently now said, I will change, regardless of the situation of COVID? If COVID wasn't here, I would still do this now because it makes sense. Has any of that happened for you?
Well, now the situation is totally different than 3 months ago, no? Because
Yeah.
For me, the most impressive is that we can restart surgery very early because, as I said before, in June we did the same surgeries that 1 year before.
Right.
The recovery is this virus is a little bit crazy because you can start and going down, but in 15 days you can recover it, no? Which is a little bit crazy, no? But now the situation is totally, for us, no, for orthopedic surgeon and for our relationships, totally normal. In general, totally normal. We are going, all the people in the hospital, we are working, we are not ill people. The 10 persons that, no, 8%, the 10% that we have 8 persons are all in the beginning. We don't have any COVID positive staff member since the last of March.
Ah, got it. Okay.
We are living without fear. No, I don't live with fear.
Right.
I have my parents in, but the old people, yes, that old people are in home. They are they're not doing going to restaurants. No, my parents, they didn't go into restaurants. The old people are doing totally different, and the normal people and young people are doing normal life now. But
do you know, do you have a sense of how high this peak will go? Because it looks like it hasn't peaked yet. Like, in other words, if this is a second wave, it looks like it's still climbing. It looks like you're still in this period. You don't believe you've peaked yet in the second wave. There's still cases coming and rising?
Yeah,
I think
probably it's going to be there's going to be more cases every day, infected cases every day, and probably the number of casualties will increase also. What I presume that is going to happen is that probably during the next weeks, we will go back to implant rigorous restrictions again, not to isolate the population, but more restrictions yet. It is going to be probably.
Okay, well, again, another sobering view of what's happening. It just seems that we're continually learning, and you're at the forefront, I think, in helping us think through this, through your academic work and also through your careful presentation of data. I can't thank you both, Ernesto and Joan, for taking time to create these presentations, but also to share them. And we'll do our best also to share this. I almost feel as though we should be doing a full report on insights into the second wave as you're learning and you're gaining. I think probably you said a couple of weeks from now, you'll have even more insight. And I may once again check in with you. But thank you both for taking time with us today on the Orthopod. And we continue to wish you the best of health. And certainly the care of your patients are a priority for all of us. So thank you so much.